Thank you very much, Dr. Jacobs, and Happy New Year to everybody. And I just wanted to, before introducing my colleague, Honorable Clark, just to say thank you very much to everybody I've been serving on this committee with for the past 2.5 years. It's truly been incredible. And I know that the work ahead of you is immense, but I have no doubt that all of you will be able to pass legislation that the country needs and that we can all be proud of. So thank you for all your work and for having contributed to my knowledge of parliamentary systems. I will miss you all so very much, but I'm pretty sure we will meet in the Houses of Parliament and in other parliamentary engagements. And just to also bring the members up to speed, Michelle Clark will be replacing me in the committee. The team remains the same. Honorable Wilson is still very much part of the committee, and Honorable Ishmael is also still part of the committee. So there's also incredible sort of continuity, and I have no doubt that all of you will receive Honorable Clark and onboard her as much as possible. So thank you very much, Chair, and thank you for the opportunity to say a few words before I bow out.
Thank you very much, Honorable Kahobe. Yes, we do see you in the house, but you sit so far away from us. When we look again, you're gone. So hopefully you'll take some time out to hopefully let's greet one another.
Absolutely.
I would like to know. Honorable Clark, you're very welcome to our portfolio committee. You're probably aware of who the members of this portfolio committee are. We'd like to see your face, though, and we'd love to hear just a few short words from you. I'm hoping that you are here. I'm sure you would be. If you can maybe switch on your camera and maybe just introduce yourself to us. Thank you.
Thank you, Chairperson. I'm so sorry that I am in a vehicle. I'm 5 minutes away from my home. My flight only landed about 15 minutes ago, so just excuse that. It would normally not happen. Just to say to you that I'm looking really forward to working with the committee. I've done a lot of reading up during the December holidays around issues, to do with the committee. And I think you seem to be a really great team that collaborates with each other, and I look forward to following in big footsteps of my previous predecessor, member Kharube, and look forward to it. Thank you, sir.
Thank you very much. You're very welcome. Before we even go further than that, honorable members, we'd like to have a look at our attendance register. Honorable Ms. Machalamba, can you tell us who's in attendance and also whether we have any apologies this morning?
Good morning and thank you, Chair. Present is Dr. Jacobs, Mr. Munyai, Ms. Keller, Mr. Sokacha, Dr. Harvard, Ms. Clark, Ms. Wilson, Ms. Ishmael, Ms. Chirwa, Mam Thengwa, Mr. Van Staden. I've received apologies from Dr. Tembe Kwayo and Mr. Imam Sheikh. Thank you, Chair.
Thank you very much. Our PLO, Joe Khatla, if you can indicate who is present from the ministry and from the department. Mr. Khatla, if you're not able to, let me welcome our Deputy Minister, Dr. Sibongiseni Dlomo, to the Portfolio Committee meeting this morning. Dr. Dlomo, you're very welcome to say a word.
Sorry, Chair.
Your connection is not so good. Just try again, Mr. Khatla.
Yes, sorry, Honorable Chair. Yes, my name is Joe Khatla. I'm the PLO, and the Deputy Minister has logged in as well. But we do have senior management, some senior management from the department as well to listen in the meeting. Thank you very much, Chair.
Thank you very much. Deputy Minister, it is a new year. Maybe you'd want to wish us all a happy new year. Can you please maybe just show yourself and say a word or two?
No, thank you very much. I have been introduced, Chairperson. Thank you. Just to be part of you to listen on the deliberations, and congratulations to Ms. Kwahube on her new deployment, and thank you very much. I'll just be part of listening. Thank you, sir.
Thank you very much. Honorable members, we had planned on resuming the NHI public hearings on the 18th of January. We were not able to do so for various reasons, but fortunately we are now back on the 25th of January. We have about 34 oral presentations to still listen to. We are hoping to complete these by the second week of February, understanding that we have members training next week. We were actually hoping, as the committee secretary and myself, to have completed this by end of next week. But let us also be mindful that there are challenges in getting hold of those who had made submissions and had given indications that they wanted to do oral presentations. So it is not always easy for the committee secretary to get hold of these people who want to do the presentations. And so we were hoping to have at least 6 to 7 presentations a day. We are, as you can see today, down to 4 because there was a postponement requested for, and we had indicated that we will allow that postponement to those who were requesting that postponement. So for today, we will be having, and I think I mentioned it already, we'll be having Bonitas, Discovery, Polmed, and MedScheme in that order. And I wish all of us good luck and good hard work as we continue to complete this work that is set before us. And let us please just do our best, honorable members, to endeavor to complete this work not later than the second week of February. So, honorable members, before we proceed, I would like to remind you that this is a virtual meeting, which is deemed to be in the precinct of Parliament and therefore constitutes a meeting of a committee of the National Assembly for official purposes only. In addition to the rules of virtual sittings, the rules of the National Assembly, including the rules of debate, apply. Members enjoy the same powers and privileges that apply in a sitting of the National Assembly. Members should equally note that anything said in the virtual platform is deemed to have been sent to the House and may be ruled upon. All members who have logged in shall be considered to be present and are requested to mute their microphones and only unmute when recognized to speak. This is because the microphones are very sensitive and will pick up noise which might disturb the attention of other members. When recognized to speak, please unmute your microphone and connect your video. Members may make use of the icons on the bar at the bottom of their screens, which has an option that allows a member to put up his or her hand to raise points of order. The Secretariat will assist in alerting the chairperson to members requesting to speak. And when using the virtual system, members are urged to refrain or desist from unnecessary points of order or interjections. We shall now continue with the business of the day. Honorable members, when possible, please switch on your cameras also when you wish to say anything. I just want to ask Ms. Majalamba, is this being broadcast, this committee meeting, Ms. Majalamba? So, honorable members, let us assume that it will be even at a later date. if you please then switch on your cameras when you wish to raise anything in this meeting. We will now go over to the presenters of Ms. Majalamba. Are the presenters of Bonitas here?
Yes, Chair.
Thank you very much. We'll go directly to the work that's set before us. Can the leader of the presenters for Bonitas please indicate him or herself, and then also introduce her or his team? Thank you.
Good morning, Honourable Chair. Good morning to the members of Parliament. My name is Lee Kellekoppen. I am the Principal Officer of Bonitas Medical Fund. Joining me today is also our Chairman of our board, Mr. Opa Komane. I'm also supported by my management team at scheme level. That is our CFO, Mr. Luke Hoodhouse, our clinical specialist and head of operations, Dr. Morgan Kachwa, and our governance specialist, Ms. Matilda Marais. Honourable Chair, on this note, we wish to thank the Portfolio Committee for affording us this opportunity to present to you. But before doing so, may I also take this opportunity to wish you well for the year ahead. It is a mammoth task, as what you indicated, that you are faced with. And we thank you for the diligent work that this committee has been doing in enabling a universal healthcare system for South Africa. Chair, without further ado, I would like your permission to just share my screen, and if the Secretariat can advise if it can be seen by all parties, and just confirm that I'm audible enough.
You are, thank you very much. And we can see your screen.
Thank you very much, Chair. Chair, with your permission as well, I will just be turning off my video just to ensure that it's clear enough. Thank you very much. Chair, starting off, and to the members of the committee, we felt it fitting to commence.
Sorry, Mr. Kollapen, sorry about that. Kollapen, just to remind you, I have 45 minutes for this presentation, and then we will have a discussion of 45 minutes.
Confirmed. Thank you, Chair. Honourable members, just to start off with an overview of who Bonitas Medical Fund is. We are a duly registered medical scheme in terms of the Medical Schemes Act. Key for us within the private sector currently is to ensure to make quality healthcare more affordable and more accessible for all South Africans, and not only necessarily for members participating, but our intent is to ensure that our mission extends broader than just the private healthcare. And for that reason, we thank you for allowing us to make the submission. In terms of our profile, Chair, we were established 39 years ago, and we have got a proven track record in terms of providing medical aid to members that has participated on our scheme. We are also very proud to advise that we are the second largest open medical scheme. And the reason why I'm sharing this pertinent point in terms of being the second largest medical scheme, although only a small proportion, covering a small proportion of the South African population, as you will note on the top left-hand side, we've also illustrated the type of claims that we process on a daily, annual, or even on an annual basis. And you may be asking, why am I sharing this? The reason why we're sharing is that we will be drawing during the submission, as what we have done in terms of our written submission to the Health Portfolio Committee, that healthcare is a very complex ecosystem, as we all well aware, and I'm sure I'm speaking to the converted. But to embark on a mammoth task such as universal healthcare, it is quite important that we understand that it is two complex systems that comes together in terms of serving the primary end user or South Africans, and that is bringing health and finances together, which can unlock a very emotive experience. And to that end, the experiences that we have learned over the last 39 years is that we have to ensure that we put the member, the patient, or the end user in the center of all that we are doing in understanding it, and more so doing it in a responsible manner. And to that end, focusing on the top right-hand corner, you would see that I've also highlighted what we as Bonitas and through our Board of Trustees value greatly in terms of discharging our fiduciary duty and our responsibilities. It is that of solid and good corporate governance. And this will equally be applicable if a successful system in the form of a universal healthcare is needed, that corporate governance becomes top of mind in all that is done. Just also a few other indicators before I step off and move into our submission. We're currently responsible for 333,141 principal members. That is the information that was available during our last publication of our financial results at the end of 2020. However, I'm very pleased to say that even during the COVID pandemic, and based on how we have approached healthcare for our members and for South Africans, this number has now increased to 354,000 members, which we are very proud in terms of being able to ensure that more South Africans have access to quality healthcare. Chair, moving on to specifically our submission on the bill. First of all, I wish to add that based on what we submit for consideration, it does not remove in any way the fact that we support the concept of universal healthcare, or as has been tabled in the bill, NHI. Access to quality healthcare is quite important, both for us as a medical scheme, but more so for South Africans at large, and also individuals as intended to be covered under what is proposed in the draft bill and aligned to the intent of what has been set out in documents such as the World Health Organization, its intent. We believe it's important in terms of the removal of inequality in terms of the healthcare system, and that more people should actually have access to quality healthcare. Chair, then focusing on the slide, and just to emphasize the point that I've made, is that as Bonitas Medical Fund, we support the concept of universal healthcare as contained in our constitution in terms of Section 27, which is the right to healthcare. We believe it's important for us to improve access to quality healthcare in South Africa and to enhance the quality of life of South Africans. We have heard many times during the last couple of months as we've been navigating and trying to overcome the pandemic around the impact of the burden of disease on individuals. And we believe that by addressing it constructively and in a collaborative fashion between private sector and public sector, that we are able to ensure that we're addressing the socio-economic imbalances and injustices and inequalities that existed from the past. Chair, to that point, in terms of the NHI bill, is only one aspect of achieving universal healthcare, as we very well aware. And it's important that the bill makes provision that it also covers a broader and addresses the intent around achieving universal healthcare in a broader healthcare framework. So access to healthcare must be driven by two factors: funding as well as the quality of care. And to that point, Chair, and what the committee will see, what our main purpose of our presentation is separate from what we have put in our written submissions, is that we believe that there's definitely a role for private medical schemes in a NHI setup. Although the current bill only talks about a complementary role, we believe that by considering the submissions that will be made, is that there's a key role for both the private sector in collaboration with the public sector to work towards achieving universal healthcare. To that point, another key aspect that we want to highlight out of our submission is we have noted from the draft bill that there's a key definitive date being set. We'd like to appeal to the parties responsible to direct that process, such as your own committee, to consider a more milestone approach that is needed to ensure that universal healthcare is achieved, but more so that it is done in a milestone approach, that it is done in a transparent manner, to build the trust capital of all South Africans in relation to what is intended to be achieved out of universal healthcare. Chair, just to share a little bit of anecdotal aspects of what we have experienced since the bill was tabled in the draft format, is a lot of our members started questioning, is there a need for a medical aid? Is there a need for them still to continue in light of NHI or universal healthcare? And to that end, the key aspect that is forthcoming and that is concerning for us is contained by the fact that it places greater pressure on the private sector, on the public sector, as individuals in this uncertainty that is currently presented in the bill, which we will highlight, that needs to be addressed, that those members or individuals will move to the public sector and place a greater burden on their already strained resources. And for that reason, a collaborative approach supported by a milestone and integrated way of measuring whether certain outcomes are being achieved is probably the most responsible manner in which we can approach NHI. Chair and committee members, moving on to our submission, we're very mindful that this committee will probably see hundreds of verbal submissions as well as written submissions. We did not intend to duplicate and waste the committee's time from what we have put in our formal written submission in 2019, but rather just to extract and highlight some pertinent points that we believe and humbly appeal this committee to consider as part of reviewing the draft bill. These are just the elements that I will be covering during the presentation and our submission. And it is 6 elements that we specifically wish to highlight and appeal to the committee to consider. A key aspect is the impact and the pressure on state resources and infrastructure. As I've mentioned, since the draft bill was tabled and became public, more questions than answers has been raised, but more so we as a medical scheme face the risk of members exiting and depending on state resources and infrastructure. Keeping in mind at that particular point in time, we weren't facing a pandemic, and more so we have seen what a pandemic can have on the pressure or the infrastructure of both the public and the private sector. Language is also an aspect which we've covered in our written submission. I will not be spending too much time in today's presentation on it, but we also appeal that certain language issues be considered. We also note that there will be potentially in the current format, should this bill just proceed in its current format, there will potentially be constitutional challenges or issues being raised. And we believe and allied to the point around taking a milestone approach and applying our minds in terms of what universal healthcare is, that these can be overcome and that we will not be hindered by constitutional challenges that will prolong access to universal healthcare, where all South Africans can have access to more affordable and quality healthcare. A key aspect that we really intended to highlight today to the committee is the issue around corporate governance around the Nhi Fund. I think it's a common cause that trust capital of South Africans has deteriorated from, and this is my own personal opinion, but for us to, in terms of drive a noble intent such as universal healthcare forward, is that we need to instill good corporate governance that is transparent and that hold individuals accountable. The flow of funding from Nhi Fund to service providers is also a critical point of consideration, and I will highlight this in more detail in the coming slides, as well as the maintenance of the purchaser-provider split through the national healthcare system. Chair, moving then on to the first point and to substantiate the importance in terms of why there should be a coexistence and a collaboration between private and public sector. As can be noted is that from the statistics and analysis that we perform, is a large portion of South Africans is dependent on the state. These include people with disabilities, unemployed, armed forces, etc. only 28% belong to a private medical scheme and have a health insurance policy. And this clearly illustrates the inequity that exists in terms of ensuring that all parties, all South Africans, should actually have a balance to it. However, it brings about the challenges that we know exist within our healthcare system, and that is that it places an immense amount of pressure on both systems to be able to give access to good quality healthcare. There's fewer health facilities in the private sector. The location of these services needs to be aligned with all sectors. And as we know, staffing challenges is a key aspect. And since the tabling and while this process unfolds, has created doubt in our healthcare workers in terms of their future and what it would mean. And for that reason, why it is important, and we welcome this engagement, that these aspects will be unpacked. One aspect that we did not cover into too much detail, but we would like to make a point of it, is that the bill needs to be supported by a comprehensive human resources strategy and plan to enable the access to universal healthcare. So the key takeout from this particular slide for us, and which we put forward to the portfolio committee for consideration, is that there needs to be consideration during this process around how medical schemes should exist along NHI to assist in terms of achieving universal healthcare. Further to that, the other key aspect around the slide is that South Africans should be free to choose which funding system to support. A single payer system will place immense amount of pressure on one single entity of fund to be able to execute and implement against their mandate. And this links back to the earlier reason and rationale why we just pointed out how much transactional and cost activities goes along with managing healthcare. And that is just pertaining to a small fund such as Bonita's Medical Fund. We believe to enable this coexistence, that apart from the intent of rolling out and drafting a NHI bill, that healthcare reform is sorely needed to ensure that, and specifically healthcare reform within the private sector is needed to ensure that this burden is not exacerbated on state resources. And to that end, moving to the next slide, is that we would humbly appeal to this committee to consider and we recommend the implementation of the health market inquiry recommendations, specifically in the private sector. These reforms are needed specifically through enabling pricing standardization and quality. There is no doubt that the cost of healthcare in the private sector is astronomical. And yes, as much as medical aids and board of trustees, through the assistance of the regulator, has tried to ensure that it remains sustainable with approximately 8 to 9 million South Africans being covered and alleviating that burden of healthcare from the public sector, it is still too costly. And to that end, one of the key aspects, and to make sure that more people have access to private healthcare, we believe that reforms, as what has been recommended in the health market inquiry, such as pricing standardization and quality, needs to be enacted on while we unpack this journey of universal healthcare in the NHI. We also believe that the development of base packages of services for medical schemes is needed. And this has also been spoken about in the bill, but it's not clearly clarified in terms of what those base packages will be, which we also can read into that it would be dependent on what resources is available to cover those benefits on an annual basis for members on the NHI or for citizens on the NHI, which creates a bit of uncertainty and doubt potentially in people's mind. Formulation of a supply side regulator is needed. And I think our learnings during the COVID pandemic has clearly indicated why this is important in terms of reducing the cost of healthcare. Case in point, recently experiences what we've seen with the test of COVID tests, how costs can be addressed. So the formation of a supply side regulator is critical for the sustainability of medical schemes into the future, but also allowing us to attract more South Africans into the private sector and alleviating that burden on the public sector, as I previously mentioned. Quality measurements in the private sector is also key to ensure that we speak to the heart and the intent of a universal healthcare, which is access to quality healthcare. Chair, moving on from the component talking about the pressure on the state resources and the importance of what the private sector can enable in terms of universal healthcare. I would like to now move on and talk about the language used in the bill. We have not specifically referenced what the key issues are in our presentation and the recommendation, but this is contained in our written submission. So I did not want to rehash or repeat it, but just to highlight key aspects is that we have found through our own analysis that the language used in the current draft bill impacts legal certainty and the rule of law. By way of example, the wording in Section 2 is restrictions on the access to healthcare, which goes against the Constitution by placing a restriction on access to healthcare on those who have the means to pay it. We're also very mindful in terms of that there's indication that healthcare providers will be contracted to the Nhi Fund and they will have to go through an accreditation process. But we also know that not necessarily all providers will necessarily participate. So to that point, these are aspects that needs to be considered in the separation of some of the wording being utilized in certain sections of the bill. The wording in terms of what we do oppose is the notion that medical schemes can only offer complementary cover as defined in Section 33. Further to this, we propose that there needs to be amendments to the Medical Schemes Act and Section 33, which is currently in conflict. And to that point, the rationale that coexistence between a medical scheme and whatever the final framework will be for NHI, we believe that it can coexist and the bill needs to make provision as such for the reasons mentioned to alleviate the burden and strain that will be placed on the state if everybody had to belong just to one single fund and being administered by one single payer. There's also some technical aspects such as medical insurance schemes that is referenced, but those do not exist in the South African context. And to that point, the demarcation rules in terms of long and short-term insurance act were not taken into account based on our review and analysis of the current draft bill. Moving on to some of the aspects around constitutional matters, to the committee members, I think key aspects that needs to be unpacked and considered in the current draft bill is the role of national government versus provincial and local government. It is quite clear from our review and reading of the current bill that there is some conflict between these roles not being clearly clarified. And these are aspects that needs to be considered. As I've mentioned previously, the restriction to the right of access to healthcare for those that do have an ability to fund and choose the access to care, these needs to be considered. We utilize some strong wording such as infringement of right healthcare practitioners to practice, but those are some of the thoughts currently in discussions and debate that happens in the market. We also believe that the bill must create clear certainty, not at all create any doubt in terms of what universal healthcare should be and what it is not. I spoke to the issue around potential openness of constitutional challenges, which should not be the intent or the objective, but to accelerate and ensure that we achieve universal healthcare for all South Africans and that we don't spend our time in arguing around these matters within courts. Chair, moving on to the corporate governance, which is, as I said in my opening, probably an area where we would like to spend a bit more time on, and this is quite important. I think our learnings as medical schemes, as regulated by the Medical Schemes Act and oversight by the Council of Medical Schemes, we have learned that through good corporate governance, one could sustain the medical scheme industry. But to do that, roles needs to be clearly clarified. And we are very proud and pleased that our current regulation enables good corporate governance and good oversight from those that is entrusted with those duties. We believe that the three roles or the three committees that's been set in the bill is slightly unclear. Starting off with the Stakeholder Advisory Committee, we believe that the Stakeholder Advisory Committee should actually be an active contributor where individuals from the public are able to be part of such committee, but become empowered to be able to actually advise the other committees, such as the Benefit and Pricing Committee or the Benefits Advisory Committee. To that specific point, we also believe that it's critically needed for the appointment of an advisory committee, as I mentioned, that is actively participating and as empowered to do so. We also, from our assessment of what we have read in the bill, the governance structures lacks a degree of accountability. And to that point, we believe that duality in terms of oversight is needed, rather than entrusting all the powers to the minister. Clear roles and responsibilities and accountability is needed, and fiduciary duties and accountability should be defined. And this speaks to my earlier point in terms of how medical schemes currently function, is that there's learnings that we can take out of how that has been defined in terms of good corporate governance and ensuring that Board of Trustees and those entrusted to run a medical scheme has clear duties and clear accountabilities, and that is managed with good oversight. We also believe the issue of collective bargaining in terms of Section 15F should be clearly defined, keeping in mind that the same issue has also been highlighted from the health market inquiry. We believe that, and our experience also of late in terms of what we have seen through managing the pandemic, COVID-19, synergies in terms of health information systems becomes critical in terms of being able to share and have access to information to make informed quality decisions. And to that point, we cannot place more onerous provisions on healthcare providers such as doctors to collect information and submit information. And to that end, we as the private medical schemes industry already holds a lot of information. We believe that that is also another role why, or other reason why medical schemes in collaboration with, or the private sector in collaboration with the public sector, can ensure that health information is drawn together to make informed decisions, such as benefit design, pricing, etc. Chair, moving on to the last part of our presentation, which specifically talks about the flow of funding. The key aspect from what we have observed in the bill, it should not be unlawful for people to purchase healthcare should they want or have the means to do so. I have also noted from other presentations that's been done to this portfolio committee and also from our own analysis that all international concepts of universal healthcare actually makes provision for freedom of choice, where our current draft expressly states that it would be illegal to purchase outside of the NHI. Medical schemes should be able to continue to act as a purchaser and payer of healthcare services. I think this is a critical component for the reasons advanced as well. And that needs to be clarified versus the current statements or wording that was utilized that talks about complementary, but we're not quite sure what it would mean. Further to that, we also don't understand what those benefits would entail. So certain of this work still needs to be performed before we finalize it and set it out in the bill. As also mentioned, NHI should be phased in, starting with cover for the more vulnerable population groups. And this speaks to the key point around taking a milestone approach rather than a definitive set date of 2026. Chair, the last point around it is around the funding of the NHI, and just to emphasize or clarify what our real key areas of concerns are. It is in section 49(2) small a, which indicates that part of the funding for NHI will be sourced from medical aid tax credits. That, in our humble opinion, if it becomes a funding mechanism, we are not opposed that it becomes, but it must be done in a responsible manner. But also wish to warn that the risk associated with it is that should a medical tax credit be immediately removed, is that you do have the risk of more people leaving the private sector and becoming reliant on the public sector for healthcare. And the reasons already being substantiated in terms of the impact that it can have on resources. Apart from section 49(2) small a, there's also no clarity in terms of how the NHI bill will be funded. And this is a key concern for most of our members, but I think for us as South Africans at large. And this needs to be clarified along with the benefit package. The bill also contains no information how it will be managed, the financial planning and budgets. And to that point, although it might not be contained in the bill and might be contained in separate provisions, these are aspects that requires clarity for us to be able to take universal healthcare and the NHI bill forward in a responsible manner. Chair, I thank you. I trust I've saved some time to allow the committee to field any questions or give any points of clarity on our submission. Thank you.
Thank you very much, Mr. Kola. How does one pronounce his name? Kola Koppen.
Kola Koppen. Thank you, Chair.
Kola Koppen. Thank you very much for the presentation. Are there any other members of your team who would want to say anything? Not. Honorable Munyai, I noticed your hand raised on this platform. Is there something you want to raise, or is it for a question which I've allocated you a number to? Or is it anything else? Thank you very much, Honorable Munyai.
This is a technical mistake, Chair.
All right, thank you, Honorable Munyai. Honorable members, you've had the presentation and we are very grateful for having saved some time. I'm going to mention the names in the order which the questions, in the order in which they raise the hands and in the order in which they will raise their questions. The honorable members who had raised their hands on the WhatsApp platform, it will be Honorable Chirwa, Sukacha, Gela, Wilson, Hlengwa, Munyai, Ziwela, and Ismail in that order. Any other member who still would want to raise a question, you can give me your name now and I will add you to that order.
I'm covered for now, Chairperson. Thank you.
Thank you, Honorable Van Staden. So I'm
Member Clark, please, Chair.
Clark would be number 9. So if you can please note your order, and I'm going to read it again. It would be Chirwa, Sukacha, Gela, Wilson, Hlengwa, Munyai, Ziwela, Ismail, Clark, and then myself. Thank you, honorable members. You can raise your questions in that order. Thank you.
Thank you very much, Chairperson, and compliments to all the honorable members and the staff and the people who will be presenting to us today. Thank you so much for your presentation. Chair, I think a very pivotal takeaway for me in particular, in relation to some of the points that were raised in the presentation is that, the presentation or the presenting of the NHI as a system that will lead to a higher trust in the public healthcare system or in government is actually something that is untrue, noting even the growth of this particular medical aid scheme, even during a pandemic when people were losing jobs, but they were still getting more subscriptions, even to a point of even applauding themselves on this portfolio committee, which is a great concern to me, particularly because the CMS released the 2 circulars to put an end to medical insurance, citing that the introduction of the NHI will then mean that there won't be a need for medical insurance, even though we have debated this and we've highlighted the illogical decision behind this, and that it was in actual fact in bias of medical aid schemes. I think I'm more fervent on this position today more than I was in the previous year when we were engaging the CMS. My question now to Bonitas is, firstly, what was your subscription growth rate in the previous years? You can give me like probably 3-4 years prior to the pandemic. And secondly, how has I'm sure you have this information, right? Because you're in that industry and you check the impact and stuff like that. But how has medical insurance impacted the subscription rate or members leaving the medical aid scheme over the years? And number 3, with the growth of members in the previous year, can you please highlight which particular month saw the most subscriptions of new members to the scheme? And lastly, how many grievance cases from your members do you have and are aware of with the CMS? And how many were resolved and how many were in your favor within the resolved cases? Thank you so much, Chairperson.
Thank you very much, Chairperson. Good morning to all the colleagues, and thank you very much for the presentation. Chair, just 3 questions from my side. The first question from Bonitas. Chapter 2, Section 8(2) and other sections of the bill makes provision for the medical schemes and the role they are envisaged to play under the NHI. Now, if according to Bonitas, these provisions are inadequate, what then is being proposed by Bonitas as missing in the bill in its current form, particularly in as far as the role of medical schemes are concerned? Then my second question, Chair, you hold a view that multiple fund universal health coverage system will allow medical schemes to service a new market sector. How will this new market pay for their medical schemes cover? Here I refer to the poor who are relying on the public sector. Then my last question, Honorable Chairperson, you have mentioned a few reforms that are required in the private sector, but have left out corporate governance challenges in your industry. What lessons do you think the NHI fund can learn from your industry, particularly in addressing issues related to designated service provider contract, discrimination, conflict of interest, fraud, waste, and abuse of resources? Thank you very much, Chairperson.
Thank you very much, Chairperson. I hope I'm audible. Chairperson, I've got only one question that I want to raise to Bonitas. But firstly, let me welcome the presentation. My question, Chairperson, in slide 4, there seems to be a view that the introduction of universal healthcare coverage in South Africa is equivalent to an exercise of choosing preferred healthcare funding system by the users. Can I please get clarity on this statement? Thank you very much, Chairperson.
Thank you, Chairperson, and thank you to Mr. Kalakoppen for the presentation. I am actually quite looking forward to seeing the entire presentation, or your entire submission, your entire written submission, which we do not yet have access to, but I thank you for the highlights that you have presented to us. And I want to go on to a couple of the issues that you've raised, and one, of course, is the funding of quality healthcare. Now, in our understanding of national health insurance or universal health coverage, people should, any person, any South African, even foreigners who need emergency care, should have access to health facilities already where they can go in and at free of charge can get a range of health services. Now, we know that this is a struggle on various levels. First of all, that most people don't have easy access to health facilities. Two, those health facilities are not maintained, the infrastructure is crumbling, that they are understaffed and underfunded and under-budgeted. So that, of course, is a big concern in this country, because in principle, we should have universal health coverage, and at this point is unattainable because of the current crumbling health situation. And you were quite correct that this is now, if people start cancelling their medical aids, it is going to put extra pressure on an already crumbling system. But I want to deal with medical aid specifically. And given the situation in this country and probably the world over at the moment, there are huge struggles in terms of poverty, lack of resources, people who've lost jobs as a result of COVID. So in principle, the majority are not earning at all or are earning a lot less than they did in previous years. And as far as medical aids are concerned, this is already a problem, particularly on the grounds that lots of medical aids are expensive. You can give me as many examples as you like, from your lowest coverage to your highest coverage, whatever your schemes are called. The fact remains is for people who are cash strapped, medical aid is expensive. And in most cases, despite the fact that they are paying for medical aid, they have limited access. And when I say that, I'm talking about many services are not covered. They run out of day-to-day services or day-to-day money or savings or whatever you call it, in a very short space of time. And then not only are they contributing to medical aid, they are then also having to pay for services over and above that once they have run out of funds within that scheme. Or there is a shortfall. And this creates a huge problem in terms of people wanting to be or willing to move over to the NHI system and cancel their medical aids. And I'd really like to know how you as a medical aid, and the second one in the biggest one in the country, is going to deal with issues like that. Because that does pose a problem for you, and it poses a problem for the public health sector, because those people are going to go over there in droves, quite simply because they can't afford medical aid anymore. And there is no schemes to offer them good coverage at a very, very low price. How will the NHI be funded and managed? What are the costs of NHI? Well, you're pretty much in the dark as we are, despite numerous requests and some idea of what this is going to cost to unfold, both in the short term and in the medium term and even in the long term, we are not aware of. And this has not just been raised by you, it has been raised by just about every presenter that we've had throughout this entire process. But I am curious to know from you. So the role of the minister has been queried in every single presentation. He literally has the sole mandate to hire, fire, establish boards, overlook governance, overlook finance. You know, he is the be and the end all of the entire system. I would like to know from Bonitas, how do you envision that needs to change? Okay. How do you think boards should be established? Who should be responsible for them? Does Parliament oversee the budget? Does the Portfolio Committee oversee the budget and the costs? While you've said that is an issue, I would really like to hear your recommendations on how that is closed. And we have had various recommendations from other presenters that obviously will have to be taken into consideration. And just to give an idea, you talked about